All right, let's talk about a new, non-invasive way to tackle some serious chronic foot pain.
If you have, that sharp, burning sensation might just be something called Morton's neuroma.
Now don't worry, it's not a tumor, it's just tissue thickening from nerve compression and irritation.
It's a pretty common nerve issue, and it shows up a lot more often in women.
So, how do we usually treat this? Well, there's a standard step-by-step approach.
You'd typically start with the simple stuff first, then move on to the more invasive options.
But here's the problem. Those common injections, they often just don't work long-term.
Yeah, the failure rate for corticosteroid shots can be as high as 50% within a year.
And getting them over and over can cause some pretty serious irreversible side effects.
Even surgery, which is the absolute last resort, isn't always a guaranteed fix for the pain. So that big gap in treatment has researchers looking for something better and less invasive.
And that's where shockwave therapy, or ESWT, comes in. It's a really promising option. Okay, so it's like a 1-2 punch. First, you get immediate pain relief, then long-term tissue repair.
But here's the key thing. How you do the treatment really matters.
So a new review suggests a way to optimize the whole process for much better results.
Okay, so what's the logic here? First up, why more than one session?
Well, repeated sessions help the tissue heal properly and keep faulty nerves from growing back.
Now this next part sounds a little weird, right? Why on earth would you skip anesthesia?
Believe it or not, it can actually block the healing signals the shockwaves are trying to send.
And last but not least, what about the intensity of the treatment itself?
You want the highest energy a person can comfortably handle. That ensures it gets deep enough to work.
So, the big takeaway? Optimized ESWT is a powerful new tool against chronic foot pain.
Researchers think this could become a standard therapy, helping people avoid surgery altogether.
It really makes you wonder, could this be the future for treating chronic foot pain for good?